Thank you, Lester. Secretary Clinton, Senator Sanders favors what he calls Medicare for all. Now, you said that what he is proposing would tear up Obamacare and replace it. Secretary Clinton, is it really fair to say that Bernie Sanders wants to kill Obamacare?
Well, Andrea, I am absolutely committed to universal health care. I've worked on this for a long time. People may remember that I took on the health insurance industry back in the 90s, and I didn't quit until we got the Children's Health Insurance Program that insures 8 million kids. And I certainly respect Senator Sanders' intentions. But when you're talking about health care, the details really matter, and therefore we have been raising questions about the 9 bills that he introduced over 20 years as to how they would work and what would be the impact on people's health care. He didn't like that. His campaign didn't like it either, and tonight he's come out with a new health care plan. And again, we need to get into the details. But here's what I believe. The Democratic Party in the United States worked since Harry Truman to get the Affordable Care Act passed. We have a path to universal health care. We've accomplished so much already. I do not want to see the Republicans repeal it, and I don't want to see us start over again with a contentious debate. I want us to defend and build on the Affordable Care Act and improve it.
Okay.
Senator Sanders.
Secretary Clinton didn't answer your question. Because what her campaign was saying, Bernie Sanders, who has fought for universal health care for my entire life, he wants to end Medicare, end Medicaid, end the Children's Health Insurance Program. That is nonsense. What a Medicare for All program does is finally provide in this country health care for every man, woman, and child as a right. Now, the truth is that Franklin Delano Roosevelt, Harry Truman, you know what they believed in? They believed that health care should be available to all of our people. I'm on the committee that wrote the Affordable Care Act. I made the Affordable Care Act, along with Jim Clyburn, a better piece of legislation. I voted for it. But right now, what we have to deal with is the fact that 29 million people still have no health insurance. We are paying the highest prices in the world for prescription drugs, getting ripped off. And here's the important point. We are spending far more per person on health care than the people of any other country. My proposal, provide health care to all people, get private insurance out of health insurance, lower the cost of health care for middle-class families by $5,000. That's the vision we need to take.
Well, if I can, you know, I have to say I'm not sure whether we're talking about the plan you just introduced tonight or we're talking about the plan you introduced 9 times in the Congress, but the fact is we have the Affordable Care Act. That is one of the greatest accomplishments of President Obama, of the Democratic Party, and of our country, and we have already seen 19 million Americans get insurance. We have seen the end of pre-existing conditions keeping people from getting insurance. We have seen women no longer paying more for our insurance than men, and we have seen young people up to the age of 26 being able to stay on their parents' policy. Now, there are things we can do to improve it, but to tear it up and start over again, pushing our country back into that kind of a contentious debate, I think is the wrong direction.
I have to talk about something that's actually working in our state.
No one is tearing this up. We're going to go forward. But what the Secretary neglected to mention, not just the 29 million still have no health insurance, that even more are underinsured with huge co-payments and deductibles. Tell me why we are spending almost 3 times more than the British, who guarantee health care to all of their people. 50% more than the French, more than the Canadians. The vision from FDR and Harry Truman was health care for all people as a right in a cost-effective way. We're not going to tear up the Affordable Care Act. I helped write it. But we are going to move on top of that to a Medicare for all system.
Andrea,